Whose woods are these? I think I know. His house in the village though. He will not see me stopping here. To watch his wood fill up with snow.
Leprosy is a infectious disease, as tuberculosis is, and with the modern drugs is 100% curable if detected early. The patient may come to you with a single spot which is discolored, which is not taken care of when the condition progresses, and a time comes when surgery is required. Many times the patients are not taken in public hospitals, they are rejected. As they are rejected, the disease goes on increasing, the organs goes on malfunctioning, and ultimately he loses the organ.
Dr. Samant is a renowned doctor and social activist in Goregaon, Mumbai. On 28th of May 2012, the Honorable Vice President of India, Mr. Mohammad Hamid Ansari, felicitated him with the International Gandhi Award, issued by the Mahatma Gandhi Memorial Leprosy Foundation. Selection of Dr. Samant for this award was not a coincidence, but more importantly, an honor to his 5 decades of extensive and dedicated work for leprosy patients and below poverty line patients for their treatment and upliftment. Those were the days when the society was plagued with absolute misunderstandings and hatred towards leprosy. Even many other doctors in that period hesitated to treat such patients.
I started my practice at Goregaon in 1961. From 1961 to 1971, I used to visit a scientist settlement between Dahisar and Balwadi, where about 4,000 to 5,000 people used to stay. 70% of them were lepers. Helpers of Marys were working there, and I joined them as a doctor.
Dr. Samant worked in these slums. He not only treated the patients but also provided them with medicines and basic amenities such as drinking water, street lamps, ration cards, lavatories. His Holiness Pope Paul appreciated these efforts by Dr. Samant and bestowed him with the famous Benemerenti Award and Gold Medal in 1969. There were a considerable number of poor leprosy patients living in Agashi, Arnala, Virar, Vasai villages. Dr. Samant treated them without charging any fees, which made him popular as a poor man's doctor.
I knew that the land was stony hard, nothing was going there. But I made up my mind that I must make 100% use of this land. Under a tree, I used to examine the patients in the afternoon.
Thus, the Trust for the Leprosy Affected People was formed. On 24th June 1978, the organization was renamed as Lok Nayak Jaiprakash Narayan Leprosy Eradication Trust with the consent of Jaiprakash ji. His true inspiration was his beloved mother. Many of Dr. Samant's colleagues, eminent personalities and charitable institutions have helped in providing total free medical help.
हॉस्पिटलचे एक मेल वॉर्ड आहेत आणि एक फिमेल आहे. सध्या फिमेलमध्ये 22 लेडीज पेशंट आहेत आणि जवळजवळ 46 पुरुष पेशंट आहेत. त्यामधील काही पेशंट हे अतिशय क्रिटिकल अवस्थेमध्ये होते की ज्यांची हातापायांना खूप मोठ्या मोठ्या जखमा, अक्षरशः किडे पडलेले पेशंट आम्ही बघितले. पण डॉक्टर सामंतांनी त्यांना इतकं चांगल्याप्रमाणे हँडल केले आणि अजूनही ते पेशंट आहेत.
Today, the trust has a cottage hospital with facilities and equipments to carry out X-ray, sonography and laboratory, along with a modern operation theatre. And everything is provided free of charge. 15 acres of land is under cultivation where paddy, crops, vegetables etc. are grown. While a small dairy is established, which is enough to suffice the need of the inpatients.
As the institution started progressing, the surrounding Gram Panchayats felt that this leprosy hospital which is coming up will spread the disease among the Gram Panchayats. People will be affected more. In the outburst of that anger, attack came on the institution. When one ward was put on fire, 5,000 saplings which I had planted, they were uprooted. My car was stoned and there was a reign of terror everywhere. My colleagues left me. A lot of cases were put against me. I was going to the courts for 10 years. I was going to the police station for practically once in 2 weeks. I was completely shattered. In those moments of despair, it was my mother who told me, Jagdish, if you stay at the house, I'll feel myself ashamed. If when you do social work, these things are going to come.
However, like the golden sun slicing through dark clouds, Dr. Samant and his work shined with heavenly glitter. These significant efforts to give a new life to damaged bodies and discarded hearts were outstanding and remarkable.
माझी दखल स्वतः मोठ्या डॉक्टरांनी घेतली. डॉक्टर सामंत यांनी मला चेकअप केलं. माझा पूर्ण पाय कामातून गेला होता. अक्षरशः भगवतीमध्ये मला कापण्याचे सांगितलं होतं. पण 24व्या दिवशी मी डिस्चार्ज घेऊन इथे आलो. त्यानंतर माझी पूर्ण देखभाल करून हा पाय आज एवढा बरा झालेला आहे.
The effort is not just to treat these patients, but also to create awareness among society, with the aim of complete eradication of this disease. A primary school for children of wandering tribes was started in 2007. Dr. Samant's vision was not limited to just curing people, but also to train them to develop skills through various vocational training programs. Cured leprosy affected along with below poverty line individuals are trained in agriculture, horticulture, goat keeping, nursing, tailoring, fishery, dairy farming. While with the collaboration with BARC, Rural Technology Project is introduced, wherein biodegradation of banana trunks are used to generate energy.
महालक्ष्मी टेम्पल प्लस ही जयप्रकाश नारायण संस्था यांच्यातर्फे मला 2002 साली 10वीला स्कॉलरशिप भेटली. तेव्हा पहिल्यांदा माझा डॉक्टरांशी परिचय झाला. 2009 ते 2010 साली हे ग्रीन हाऊस उभारून आम्हाला स्वतःच्या पायावर स्वयंरोजगार उपलब्ध करून दिला. नर्सिंगच्या मुलाला विद्यावेतन, टेलरिंगच्या मुलींना विद्यावेतन, येण्या जाण्यासाठी भाडं. आज त्याच मुलींचं नर्सिंग आणि टेलरिंग कंप्लीट होऊन त्या मुली स्वतःच्या पायावर उभ्या आहेत.
The problem was this: if they don't get a stipend, they will not come. Because if one girl is the sole earner in the family and she comes here to learn, who is going to give them food at the house? So we started giving a stipend to the nurses, 1500 rupees per month, 800 rupees per month to the tailoring students, and in this way the things are going on very well up till now.
The work still continues. Even at the age of 78 years, there is no change in his daily schedule. There is no alternative for consistency and hard work, he says. Recently, the trust has adopted Belwadi, a hamlet 20 kilometers away from Waliv, for its total upliftment. There is not even a footway to go to the inner settlement. The old school, run by Zilla Parishad, is in shambles.
माझ्या शाळेचे नाव प्रतिभा विद्या मंदिर खानिवडे आहे. माझी शाळा जवळ असावी असं मला वाटतं. जायला यायला 2 तास लागतात.
Belwadi is our new venture. For the children, we are starting a school where they will get primary education, they will get some food, because in our school the children come only because they get something to eat. This is a fact one has to digest, because at home there is scarcity of everything.
Things have changed slightly over the years, but not up to the mark.
इथे काम करताना असं लक्षात आलं की बरीच चांगली माणसं येतात आणि थोडंसं लांब लांब राहतात, नाकाला रुमाल लावतात आणि एक प्रकारची भीती त्यांच्या मनामध्ये असते, आम्हाला सुद्धा होईल का. मग त्यावेळेला आम्ही त्यांना सांगितलं, हा कंटिन्यूअस नाही आहे बघा, आम्ही आमचे डॉक्टर स्वतः अशा लोकांच्या हातून ते पाणी पितात.
मला 15 वर्षे झाली इकडे आणि दोन्ही पायांना जखम होती, लय आजारी होती. डॉक्टरनी मला औषध पाणी करून चांगली केली. घरातली माणसं मला उभी नाही करत म्हणून मला इथेच राहते मी.
After working for practically 50 years, I feel much has left to be done, but life is always short. Previously colonies were made because the cured leprosy patients were not accepted in their houses. They had no home to go. In here in this institution, everybody after being cured is made to go. Not with force, coercion, but their relatives are convinced beyond doubt. I feel this is the achievement of Jayaprakash Narayan Leprosy Eradication Trust.
People like Dr. Samant definitely proved to be a ray of hope. Till now, whatever efforts are made are out of own pocket, and later, with kind support and help of colleagues, friends, and well-wishers. But that is not enough. More is needed. Dr. Samant believes when there is a will, there is a way. Come, let's join hands together for a blissful journey to bring a smile.
The woods are lovely, dark and deep, but I have promises to keep, and miles to go before I sleep, and miles to go before I sleep.